Mental Health Awareness Month and our nation's youth, and really not just youth, but we're going to focus a little bit more on that. It seems to be in the midst of a mental health crisis. Just anecdotally to me, it seems something that really started to ramp up during the pandemic and hasn't necessarily gotten better. Joining me right now in studio is pediatrician Dr. Joy Hong with ProHealth Physicians in Glastonbury. Good morning. Glad to see you.
Good morning. Thank you so much for having me. I really appreciate you taking the time to talk about this important subject.
And that is always the first thing we need to do, is just talk about it more. We keep saying there's stigmas, and yet they're still there. Why is that?
I think that's an excellent question. And I will say one of the things that I think maybe in a way is a silver lining of the pandemic for us has been some of the destigmatization of mental health. As you said, it's extremely prevalent. We have over 40% of the population has mental health conditions. And I think when you think about that, the most important thing to realize is you're not alone, right? If you're someone who's struggling with anxiety, if you're someone who's struggling with depression, if you're just feeling generally unmoored and not quite sure of where you should be and what place, you're not alone. And so I think that really destigmatization and talking about this is where we need to focus our attention.
You know, I just didn't think about this till now, if the stigma can sometimes cause problems in another area. I've always thought about it more externally, that people don't want to talk to other people about it. Do you think those stigmas also cause people to not be self-aware that they have a problem?
Sure. I think a lot of us tend to just excuse those feelings as external stressors when actually they may be more internal situations that we're dealing with. And so I think really the first step of this is realizing you're not alone. Taking care of yourself is really important. Reaching out for help to other people is really important. I think those are the things. We're all part of a community in one way or another. We're all extremely important to each other. And so I think using those resources to take care of each other is extremely important in these situations. And then not being afraid to ask for help is most important.
And in the short time we have, I do want to focus on the resources. You mentioned one of the silver linings of the pandemic, telehealth, tailor-made for mental health concerns. That's one thing, but there are other resources, especially some new ones that you wanted to talk about.
Right. So there are a few resources I think are really important for everyone to realize. First of all, the state of Connecticut has done a phenomenal job stepping up the mental health resources. We have availability here of the 211 crisis hotline, which you can always call if you're feeling that you're unsafe, and someone will come out and take care of you right away. We also now have the availability of some walk-in mental health care centers, which are really easily accessible, and there are 3 or 4 in the state. And so those are great, and you can look those up on the Connecticut State website as well. And then always, texting is great because sometimes you don't feel like you can talk, but the 988 Lifeline is an amazing resource for people. That's a national service, and you can just text 988 and there'll be someone available to help you with any of your concerns.
Can they help you also through text, or do you just text to initiate?
Yep, you text to initiate, and then they'll reach out to you, and they'll initiate with text, but they like to obviously talk to you and can connect you with local resources as well. And so never be afraid to ask for help. I think that's the take-home message here. There are things available to help you. Talk about your mental health with your friends and reach out for resources.
211-988, those are easy numbers. And especially if you're a parent or a caregiver, the analogy I always loved was, like they tell you on a plane, if there's an emergency, you put the mask on yourself first so you can help other people. Sort of look at it that way. And again, 211-988 and those new centers in Connecticut are a great way to help. Thank you, Dr. Hong, for getting so much in a short amount of time.
Thank you so much. I really appreciate the time.
Yes.